met.
And met.
And planned.
And organized with Black organizations in the community.
Until at last they hold the first Afrocentric CHW training. This cohort becomes known as the Kings and Queens of Community Health. Much was learned from this experience.
Hi Ty, hi Beth and Susie, Sharetta, Noelle, and Dr. Jill. Now that we all have had a chance to get a little rest after 2 weeks of training and a year of planning, what do you think we learned from the training?
It's not there yet. It can still be more Afrocentric. We can build on the strengths of the CHWs that we have already trained and make this curriculum even more thoroughly grounded in the Black experience.
I'm going to be Noelle, or actually, okay, I'm going to be Noelle. That sounds like a research project. Let's write an internal review board application and put together a steering team for the community-based participatory research project and study the outcomes of a second cohort.
I think that's a great idea. We have a huge waiting list of people who didn't get into the first training, and that way we can serve them too.
I think we can also raise the funds for a second cohort.
6 months later, in January 2014, a second culturally specific cohort begins training with a newly approved IRB application for a community-based participatory research project. 11 CHWs from the Kings and Queens participate in teaching the second cohort, which becomes known as the Divine 25. The research project sets out to measure the impact of that training that it has on health knowledge, on psychological empowerment, on self-reported health status, self-reported health behavior, community connectedness, professional development, and employment status.
And what we found was conscientization, which educator Paulo Freire describes as the process of developing a critical awareness of one's social reality through reflection and action. Simply put, it's having one's consciousness raised.
One interview participant put it this way.
And there's historical trauma and how things have been a toxin from our generation to generations. So personally, the training gave me the space, the liberty to begin to heal and go back to areas that I had suppressed and did not want to come back to. I had distanced myself from the pain as a survival mechanism, but could not actualize healing until you could give it a name, until you can touch it and say, this is that, this is PTSD, or this is trauma, or this is abuse.
And the people woke up.
We found 4 different types of awakening.
The first type of awakening is awakening to our own woundedness.
One participant said, it made me focus on me and the things that were oppressing me.
Then there was a step forward. The second type of awakening was an awakening to a need to make a change in their own lives. This type of awakening was rooted in a resistance to oppression.
I made a thing of, they're not going to kill me, not this easy. I can fight my own stuff, but I'm not going to fight to stay alive with this crazy stuff.
We learned that in community, that's right there. Okay. We learned that in community health working, if we give so much to others that we don't take care of ourselves, then the job is not really getting done. So for me, it was even for me to get more focused on my health.
The third type of awakening was a professional awakening.
It validated what I'm doing in my career professionally, that I was on the right track, that I handled things appropriately.
And then the fourth type of awakening was cross-cultural awakening.
Something that I learned that was very valuable in the training was learning from a different culture, what they are taught when they come to the United States. But what it has done for me professionally is to reach out, communicate, and have conversations with people from African immigrant cultures to learn even more than what I learned in the training.
So after completing the Afrocentric training, CHWs, community health workers, went on to become involved in the greater CHW movement in a variety of ways. Some joined Orchua and have attended or presented at Orchua and other conferences, and some have received additional CHW training and certification. Others have gotten new positions as CHWs or community organizers. The movement of CHWs is growing, and it's growing stronger. As we develop Afrocentric solutions for the Black community, our community, we are joining more and more institutions in the state and working with other CHWs to address health disparities and build a multicultural movement. Thank you.